Telus Health, which is part of Telus, the telecom giant, is opening a clinic in Toronto. It's going to accept apparently about 6,000 new patients. Now, Telus has invested heavily in healthcare data in recent years. One thing we were curious about, is this a competitive threat to Well Health Technologies? We're joined now, I love this story, by Justin Keywood, Healthcare and Special Situations Analyst at Stifel Canada. Thanks very much indeed for joining us. Can you just remind us, what do we know about the Telus plan at this stage?
Hi, Andrew. Thanks for having me. Well, it's pretty early to assess, but we see the development as highlighting a substantial consolidation opportunity in Canada for primary care, as you mentioned. And Well Health, we've been following that company for quite a while. So Well is the market share leader in Canada at about 185 clinics, but that's less than 1% of the total addressable market. So we estimate that there's about 20,000 primary care clinics, and there's some strong secular tailwinds within that industry. We're hearing of a continued strain in the healthcare services area, with a doctor shortage, but there's also an opportunity to improve the unit economics at clinics, because doctors, they're really good at providing patient care, but the operations could be improved in many cases. So quite a big opportunity, but still very early to assess.
I know doctors, they wring their hands over paperwork. It just drives them crazy. Even the billing, I think, is a nightmare for them. So if somebody can help them. Well, like these clinics, though, they're for profit. But how does it work? The doctors basically pay for them out of the fees they get from the public health system?
Absolutely. So how it works typically is there's a split 70-30. So 70% of the billings get retained by the doctor, and then 30% goes to the consolidator. And this all gets billed to the public healthcare system. Mm-hmm. But the doctors that we spoke to, they favor the consolidation model, because that frees up additional time for them to see additional patients, which leads to more billings. And under the consolidation model, doctors are typically better off. They alleviate a lot of the headaches of running the day-to-day operations, as you can imagine, including negotiating the leases, managing staff, the technology implementation. And so with the consolidation model, it frees up additional time for patient care, and that leads to typically better unit economics.
You say that typically, though, these clinics in themselves are not that profitable. What do you mean by that? So from our assessment, the typical primary care clinic, if it's independently run, is probably generating somewhere in the neighborhood of 0 to 5% EBITDA, and not fully optimized. With Well Health, we've seen clinics transformed, where we've seen over 1,000 beeps in margin expansion in some cases. And clinics could optimize in the 10, 12, 13. We've even seen as high as 15% for primary care. And then specialty care, that's a bit of a different segment of the market, but we've seen EBITDA margins up in the 20% area. So the consolidation market definitely has better unit economics. And Well Health has been, in other words, has been able to make a go of this, a profitable go?
Absolutely. So Well's model is to acquire these underperforming clinics at break even, or in some cases even losing money. And then they implement a lot of synergies out of the gate. So some of these synergies is related to consolidating the back office function, economies of scale with purchasing of supplies, and then the technology implementation. And this is a key aspect, because doctors, as you mentioned earlier, it wasn't too long ago where they were using manila folders for patient records, right? So the patient records have largely transformed to electronic base, but there's still other areas to incorporate technology, and including the early use of AI, which we're just starting to see being implemented in the doctor's office.
And should Well Health investors be worried that Telus Health? I mean, Telus has a lot of firepower financially. That Telus will erode their market share or slow their growth in these clinics.
Well, it is early. As I mentioned, Well Health, 185 primary care clinics. Telus has opened or to be opened the first primary care clinic in Toronto. But there's just such a substantial consolidation opportunity out there, 20,000 clinics across Canada. So we do see the Telus Health entry as helping to validate Well's business model. There could be some competition for future M&A, and then perhaps Well Health's Canadian healthcare network becomes an acquisition target itself longer term, but a lot of opportunity out there.
It is interesting, isn't it? I mean, what is it? 500,000 people in Toronto said to have no doctor, and it's something like, is it 1.6 million Canadians? I'm sorry, no, 6.5 million Canadians, I'm sorry. So, I mean, that really is a disgrace. Something has to be done about the healthcare system.
Yes, absolutely. There's always been a doctor shortage out there. The estimates vary. We peg it at about 15 to 16% of Canadians are unattached to family care doctors. And the verifying data point around this is the emergency room wait times. This is a data point we follow very closely. And the average wait time for admission in Ontario emergency rooms averages 20 hours right now. That's up about 40% from 14 hours pre-pandemic. So that doctor shortage is worsening, and we do need consolidation models like Well out there where they can implement the best technology to help alleviate that strain.